Dr. Howard, thanks so much for joining us here today. We really appreciate it.
Yeah, happy to be here. It's a pleasure. Thank you.
Well, we're here today to talk about Roseman University's College of Dental Medicine and the class of 2020, who were the first there to be graduating after being taught the Bioclear Method through their dental education. And to start it off, some of our audience are not all dental professionals, so can you kind of give us a little overview of what this technique is and why it's different than traditional approaches to composite restorations?
Yes. So this is a technique for restoring teeth. Obviously, traditionally, back in the 1800s, the only option was amalgam, and that worked so well that it persisted for over 100 years. And then, in the last 20 years, people have become more and more conscious about having tooth-colored restorations. So the composite material is one way of providing a tooth-colored restoration. And initially, the technique to use this tooth-colored material, the same principles were applied that was used for amalgam. But what they found is that it's two totally different materials. They don't respond the same. And so the modern composite restorative techniques that Bioclear has created or has employed in their system has helped increase the success of these tooth-colored composite restorations.
Mm-hmm. So in terms of the decision at the university, what goes into the process of deciding, okay, this is something new in the industry and we think it's significant enough, we want this to become a part of our curriculum?
So it's kind of a evolutionary process, I guess you might say. The first tooth-colored composite restorations came out in the 60s, and then there was a rapid development for the next 20 years of different chemistries, different types of composite makeup, and but the success rate never really changed over that time. Amalgam restorations in research lasted longer than the composite restorations. There are many reasons why. One of the reasons was because we were using the same prep and the same principles for the different material. And the way this evolved here was basically we're a highly focused patient-centered care facility. That's one of our dean's highest priority is patient care and what's best for patient care. And we found that we were spending half of our curriculum time teaching the students how to do amalgam in the pre-clinic, and then they'd get up to the clinic and patients didn't want it. They wanted tooth-colored restorations. They didn't want amalgam. And so the dean looked at it and said, well, there's a very low percentage, maybe 1% of the restorations being done were amalgam. So why are we wasting half of our curriculum time teaching it? And he decided that we would just become an amalgam-free school and stop teaching that and spend our time teaching composite, focusing on helping the students have better success with their composite restorations. And so that was kind of the driving decision, was just the patient's desire that they wanted a tooth-colored restoration.
Mm-hmm. And now Bioclear Method has been around for a little more than a decade, I believe. How early was it on the radar that this was going to be an approach that would make sense for students?
Well, when we decided to drop amalgam from the curriculum and just focus on composites, we wanted a system, basically had to have a solid system for teaching composites and make sure that the success rate and the longevity could match, amalgam restoration at least, or go beyond that length of time. And so basically in the beginning it was wide open. What technique, what system can we employ to help the students gain success? What we found with Bioclear was that system employs the modern composite restorative techniques, but the Bioclear company has created kind of a recipe where, if students, a novice learner, can follow the steps basically and get a fantastic result the very first time. Whereas some of the other systems are very technique sensitive and require a lot of skill development before they can really get a good result. So within the first 6 months, this came on the radar. The dean sent several of us out to the Bioclear Learning Center to evaluate it, to learn about it, and you know, matching the ease of teaching a novice learner with the result you can get for a patient, kind of put that one at the top of our list versus other systems.
Mm-hmm. So once you make the decision, okay, Bioclear is the way we're going to go, this looks like a great system for our new students to be working with, how big of a shift was it for, you know, the faculty there to start teaching this new technique?
Well, it's ginormous. I don't know how to explain that. You know, it's like jumping the Grand Canyon. First of all, we had to entirely dismantle our curriculum and reconstruct it. You know, you have to create lessons and lectures that teach the principles. You have to, you know, create assessments to verify that they've learned these principles, and then create projects that give them a chance to show that they developed the skill for doing it. So it's quite a complex process. And then, you know, for dentists, seasoned dentists, it's a lot harder than the novice learner, because you take a seasoned dentist that's our faculty, and they, you know, say they've been teaching or doing dentistry for 20 or 30 years, and now you're giving them a new technique. It's very uncomfortable for some of them to be learning it, you know, at the same time they're teaching the students, or shortly prior to teaching students, and they haven't been doing this all their life. So that was a challenge. We had to have extensive training sessions for our faculty to get them comfortable and learn the system before we could teach the students. So it's a big challenge.
Mm-hmm. In terms of the change in, you know, what students are getting out of this, obviously the industry's been shifting away from amalgam for some time, based on demands from patients, the desire for aesthetics, but insurance companies are still paying for amalgam restorations, and, you know, there are plenty of amalgams still being placed. Was this class of students taught anything about using amalgam, or are they going to go and need to find working practices that are amalgam free as well?
That's a great question. We taught them about amalgam. We didn't focus a lot of time on it. But we did have some teaching about it, about the principles of it. We didn't have any projects for them to practice it. Just basically, like I said, it's just an overview of, you know, here's what was done traditionally, and you know, the principles of it, but we didn't spend a lot of time on it. So, you know, you're right. If they go out into a clinic that say only has amalgam, they're going to have to, you know, they'll know about it, they'll be aware of it, they'll kind of know the principles and what needs to be done, but they won't have had any practice doing it.
Mm-hmm. In terms of the actual, you know, process and technique that the students are doing, are they learning different prep styles for the different classes of restorations they're going to be doing? Are they learning, you know, basically a whole new approach they might be able to bring into the practice and teach to a senior dentist when they get there?
Yeah, so the primary focus is on the modern composite restorative techniques, but yes, we do teach other traditional principles. For instance, there's some materials like resin modified glass ionomer, which, you know, a non-retentive prep, you know, it won't work in that situation. So they're taught different materials and different preparation requirements, different condition requirements for those materials, and that sort of thing.
Mm-hmm. Did this class of students know that they were the first to go through with this new changing curriculum and kind of coming out with a, you know, I would guess I'd call this a more modern approach to, you know, the bread and butter restoratives dentists are doing these days?
Yes, they were very well aware of it right from the very start. In fact, we initiated a research project at the same time we transitioned to this. So for the first part of the year, half the students, you know, were practicing a more traditional approach. The other half were practicing the new Bioclear method, and we kind of compared the results of the two. So they were aware of it. They were aware that they were also aware that they were involved in the research project, and it was interesting because in the beginning, the students that were in the modern composite, technique group were complaining that they were, they were complaining that they weren't in the group with the traditional method. And then by the end of the semester, it flipped, and those that were in the traditional group were complaining that they didn't get to be in the modern, because the modern was getting far better results than the other, and so they were complaining that they weren't in that group. So the opinions kind of changed; they flipped as the semester went on.
With that research that you guys did, and you're able to see, the side-by-side comparison of these results, does that kind of show that the industry, obviously composites have been very well adopted and they're well received by patients, but did the industry not really think about the techniques that need to match up to the materials as materials change, and just kind of went with the traditional, this is how we would fill this cavity, so we're going to do the same approach, even if the different type of material to fill?
Yeah, when you say industry, you're talking about the dental industry overall?
Dental industry overall. Like, do you think, it seems like your school made a fairly big change to embrace something new, and as you mentioned, it's a different approach to the actual preparation. It's a different approach to how you're going to, handle this restoration. And so I guess before that, had dentists basically said, we have this new material, it looks better, it feels better, but we're not going to adjust any of its chemical properties, so to speak, to make sure that we place it as effectively as possible?
Yeah, I think, like I said earlier, it was kind of an evolutionary process. Mm-hmm. Like in the beginning, they didn't really understand why it didn't perform over time as well. They understood, they figured out some of the principles. So it was kind of a race to, first they started changing chemistry. Mm-hmm. They changed the particles and the particle sizes and everything to get better polishability, better strength, better wear resistance. And then they changed chemistry to get better bonding. The one thing that never really changed until the last 10 years or so was the actual engineering of the prep. Mm-hmm. And that's one of the main reasons for failure with composites is they shrink. They shrink when you cure them. When you polymerize them, they shrink. Mm-hmm. With amalgam, it has what's called creep, where it expands after you've placed it. You can pack it hard and it'll expand a little bit. But composite's just the opposite. So when you put composite in a box-type prep, as soon as you cure that, you have tensile forces on those vertical walls that are, eventually break down with chewing stress because the composite has shrunk during the polymerization process. So it's kind of an evolutionary process to figure all these things out. And like I said, it wasn't until the last few years that we figured out, look, the engineering kind of needs to change a little bit, the way that the prep is designed to help succeed.
Yeah, and that really leads me to kind of a related question to this, which has to do with, are there other, kind of innovative approaches that the school's adopting? I know one thing with composites of late has been the research around warming composites and the impact that can have on reducing some of the shrinkage. And so is the school looking at, some of these other ways to, adapt and teach students some of these new kind of findings in the industry?
Yes, absolutely. And this Bioclear technique with the modern composite restorative principles also involves heating the composite. And so, yeah, they have heaters in all the clinics now, and we use flowable and bulk fill and all that stuff. But as far as other modalities, one of the dean's major priorities is to teach students for what's coming in the future versus teaching them what's happened in the past. So we are constantly trying to evolve and keep up with the curve or stay ahead of the curve. One of the big things right now is, that's advancing quickly is digital dentistry and scanning. And so I've just actually recently been tasked with transitioning our clinical processes to completely digital. The dean wants to get rid of stone and impression material. So that's kind of what I'm working on now is helping transition the preclinic and the clinic to a more digital format.
So I imagine that's going to be another kind of complete overhaul where the faculty who haven't been using digital for a while are going to have to relearn some things, and the students are going to just pick it up pretty quickly because it's the first thing they learn.
Yep, and I've been spending a lot of time the last month training faculty and getting them on board. Well, the last year really, and it's another uncomfortable situation for them because you're right, the students, it's kind of second nature to this generation, and they just pick up the scanner and go, and the faculty, it takes a lot longer for the faculty to figure it out and learn it. And so that's where we're at, is trying to get more. We have several faculty that are taken to it, but we need to get more on board with being comfortable and helping the students do this.
Yeah. With a graduating class this year, they're now headed out to work with patients in whatever practices they go to work for. Do you expect that this is kind of the approach to go with going forward, that we want to teach these students what's coming in the industry and what's going to be standard of care going forward, rather than as you mentioned, amalgam had been taught because it had been used, but it's pretty much a thing of the past for a lot of dentists these days. So do these dentists have a leg up in the industry as they come out? They've got some, modern training. I know a lot of dentists who've been in the industry for 20 or 30 years are going to take the Bioclear courses. So, does this give recent graduates something extra as they go apply for jobs?
I believe it does. And there's, I think there's very few clinics where, very few. I think it'd be rare for a student to find a clinic that amalgam is the only option. I think there are some in some of the remote areas of Alaska, maybe, or some other remote areas where maybe amalgam is the only option. But like I said, I think there's very few clinics where that's the only option. And so having this technique, and that's been verified by a lot of the students that have parents that, when we first started teaching the Bioclear method, they told their parents about it. Their parents were like, wait, and then they went and actually went to the learning center and learned it, and felt like their children were getting ahead of them on the curve. So, and there's a plethora of clinics, especially in the corporate world, that are digital already. So this scanning experience is going to put them a leg up when they go out and get into those types of clinics. They're already going to have that experience.
Are there other techniques and technologies that are, making headway in the industry that you think should be part of education going forward to prepare the next generation of dentists?
Yeah, I think, in the area of endodontics, there's some advancements there. So in periodontics as well. I think microscopes will be valuable in the future as part of the technique. We're already seeing that, like CBCT or a cone beam, is kind of rapidly becoming the standard of care, especially with implant placement, things like that. So yeah, it's for 100 years, dentistry didn't change much, but for the last 20, it's just been evolving pretty at lightning speed.
Do you think that this ability to adapt and embrace these changes has been an important part of the Roseman University Dental School's kind of identity right now? And is this something that you think can be a hallmark for this education program?
Yeah, I do. And this is something that when students come to interview, we have a portion of the interview process where they go through and see everything. They're shown everything we're doing in pre-clinic and clinic, and they're able to see, what methods and what, equipment we have, and, they get to play with the scanners when they're here on interview day. And so I think it does stand out.
And, you mentioned, the fact that a lot of dental students have parents who are part of the industry as well. It's kind of a unique industry that has such a family, line relationship here. Do you find that the students are really excited that, they're learning things their parents, who are also dentists, didn't have a chance to learn? Has that been a good thing for them?
Yeah, it's been very good, and it's it's kind of, in some cases it's created a little competition between child and parent, and other it's created a lot of camaraderie, and so it's been good.
Wonderful. Well, Dr. Howard, I really do appreciate you making the time to speak with us today. I think it's a terrific thing to see universities really embracing the new things that are coming through the industry and preparing a generation to take care of patients even better than the generation before.
Yeah, I agree. It's an exciting time to be a dentist, and patients are, I hope they're really aware of the benefit they have these days. Because it's totally different than when I was younger and going to the dentist, and that was a dark world. But now, it's a lot better world for patients and a lot better techniques and materials. So it's an exciting profession, and seeing where it's going is really, really stimulating.
Wonderful. Well, we really do appreciate you joining us today. Thank you so much.
Okay, thank you. I appreciate it.